The only thing harder than receiving a diagnosis of autism for your child is leaving the clinic and not knowing exactly what you're going to do next. This video is the first in a 5-part series where we discuss things that you must know if you're concerned about an autism diagnosis or if you've recently received one for your child. Hello everyone, and welcome to the channel where we strive to educate, equip, and encourage anyone who's raising a child with a disability. I remember this like it was yesterday. Meeting with young families, confirming the diagnosis of autism, walking through that, and then having a candid discussion about things that must be done immediately in order to ensure that their child makes the anticipated progress. What I realized in this process was that most people had no idea about the things that I was telling them. And this was especially concerning given that many of these things could have been done before they came to my clinic. The topic of today's video is early intervention programs. Early intervention programs are available in your city and state, dedicated to serve children between the ages of 0 and 3. These are services that are funded through tax dollars and are available to you at no cost. Not only are these services free, but they don't require a referral from your primary care provider. If you have concerns, you can refer yourself. As you can see as we log on to the CDC website, early intervention contact information is available by state. Now, each state's early intervention program has a different name, but what I want you to understand is that they exist. So what do you get from an early intervention program? Well, several things. The first of which is a developmental assessment. This is often done by a developmental teacher or a team of providers such as developmental teacher, speech therapist, occupational therapist, and potentially physical therapist. Now, certainly this evaluation can look different depending on what state you're in, but what I want you to understand is that it's often robust and timely, typically within 6 weeks of the time of the evaluation. What your primary team needs to know is the nature of your concerns, any evaluations that have been conducted so far, the age of your child, and where they'll be located at the time of the evaluation. For those of you who have children enrolled in daycare programs or early preschool environments, oftentimes these services will go to the place that the child is located in order to conduct the assessment. Whenever I see families that have not yet activated this service, it's always frustrating to me because oftentimes they've waited several months to see somebody like me, and I think of all the wonderful services that could have been provided if someone would have just initiated this referral ahead of time. One of the most frustrating things I do in my clinic is make a referral for this service when anybody else, literally anybody else, could have made this. And to be fair, sometimes the guidelines change by state, but for the most part, these services are meant to evaluate children as quickly as possible and begin the process of accessing care. Thank you for watching this video. If it's been beneficial to you, please like, subscribe, and hit the bell for notifications so that we can continue to put out this content for families just like you, so we can begin to give you the information you most need right now. Please watch our other videos so we can continue the dialogue together.